Hi, I'm Dr. Sneha Mantri, Chief Medical Officer at the Parkinson's Foundation. As a movement disorder specialist, I often hear from my patients about stigma. Today, I'll explore how stigma affects people living with Parkinson's disease and their care partners, and the ways we can push back against the negative stereotypes that surround Parkinson's. What is stigma? Stigma is when a person or group is judged or treated unfairly because of a negative belief or stereotype about them. Experiencing stigma can significantly impact the lives of people living with Parkinson's. Stigma is associated with stereotypes, prejudice, discrimination, and exclusion. What does stigma look like? Stigma around Parkinson's often begins with misunderstanding. Many people associate Parkinson's as a disease that only affects older white men who have a severe tremor or balance problems. And this narrow stereotype erases the reality that people of all backgrounds, men and women, are living with Parkinson's and managing its wide-ranging symptoms. Visible symptoms like tremor, freezing, or speech issues are often misinterpreted. A person with these symptoms may be wrongly assumed to be drunk or confused or simply getting old, rather than someone managing a complex neurological condition. These reactions can be hurtful and isolating. For many people living with Parkinson's, stigma becomes internalized. Some delay seeking a diagnosis or treatment. Feelings of embarrassment, shame, or being overwhelmed are common, especially early after a diagnosis. Others choose not to share their diagnosis with family or friends, hiding their symptoms out of fear of judgment. People with Parkinson's who are working face a unique layer of stigma. They may worry about appearing less capable or facing discrimination if colleagues or their supervisors learn about their diagnosis. This sometimes leads people to hide their symptoms or not ask for workplace accommodations that could allow them to continue doing their job. Stigma can also be a profound fear of becoming a burden to loved ones. What drives stigma? Stigma surrounding Parkinson's is often fueled by a lack of understanding. This shapes how society views people living with PD. Many people are familiar with PD's movement symptoms, but may not be aware of its many troublesome non-movement symptoms, including fatigue, anxiety, cognitive changes, and more. Media portrayals often show a very narrow view of Parkinson's. Cultural influences can also play a significant role. In some communities, long-standing beliefs can add extra layers of stigma, and in extreme cases, a Parkinson's diagnosis may be misunderstood as a warning or curse that can bring shame and isolation. These misconceptions create an environment where people with Parkinson's are often misunderstood before they have a chance to tell their story. Who is most impacted by stigma in the PD community? Stigma can directly impact someone's health. For many, fear of being judged leads to the delay of seeing a doctor, even when symptoms impact daily living. This can lead to a delay in diagnosis and treatment, allowing symptoms to worsen and reducing quality of life. These barriers can be even greater for certain communities, including people with Parkinson's in the Black and Hispanic community, who often face additional layers of stigma, combined with limited access to care, leading to an even later diagnosis. Women, whose symptoms may be initially dismissed, frequently encounter gender bias, and members of the LGBTQ+ community may hesitate to seek care due to past experiences with discrimination in medical settings. The Parkinson's Foundation believes that everyone with Parkinson's should have access to expert PD care. What research tells us about stigma in Parkinson's? Many people with Parkinson's have experienced a form of stigma. Researchers work to understand how stigma impacts people with PD. Here are a few key findings from recently published research surrounding PD and stigma. Stigma worsens quality of life for people with Parkinson's. Stigma contributes to social anxiety, isolation, hesitation to seek medical care, loneliness, and emotional distress. Stigma also shapes the Parkinson's experience. For doctors and other healthcare professionals, understanding stigma's impact can help them respond with greater empathy and more proactive care strategies. Researching stigma is critical. Bringing academic attention to the topic is critical in addressing it. What is narrative medicine, and how does it address stigma? Narrative medicine is an approach to care that uses a patient's story to build an understanding and relationship between a patient and their doctor. It encourages people with Parkinson's to share their PD experience to help their care team address the issues that matter most to them. Research shows that this approach can strengthen a person's sense of independence and reduce feelings of stigma. Sharing one's story can help connect with others who are dealing with similar issues. It can also help reframe a potentially stigmatizing issue into one of agency and empowerment. Ways to combat stigma. One of the most powerful ways to reduce stigma around Parkinson's is through education and staying connected. The Parkinson's Foundation works to share information about Parkinson's to help spread awareness and knowledge, breaking down the misconceptions that fuel stigma. Humanizing Parkinson's through personal stories, like the one shared in the Parkinson's Foundation's My PD Stories, allow people to humanize this disease and highlight the resilience of those living with it. Events that highlight narrative medicine through the Parkinson's Foundation or local organizations can also be a great way to share your story. Community engagement is also vital to combating stigma. Everyone can contribute to raising PD awareness, from learning the early signs of Parkinson's to volunteering and sharing Parkinson's content on social media.